There actually, I heard yesterday about a triple variant, but the one that we're talking about is the double mutation that has had India placed on the red list of a number of countries. Just tell us about this particular one and how much we know about it, Nicola.
Yeah, you're right, Adnan. There are 3 mutations in India, but this variant 2 is the one that's of global concern, as you say. Now, I've been speaking to a couple of experts here in the UK this morning, and both of them say that there's anecdotal evidence that this particular variant is more transmissible, but they haven't got scientific research to back that up at the moment. But that's certainly the thinking. And of course, because there's been a lack of vaccination in India, that's why, and there's been, as you said there, lack of social distancing, that's why it's just been absolutely moving through the country so rapidly. So Professor Paul Hunter, who's one of the experts I was talking to this morning, said it probably first came about just before Christmas, but it was January when it became very virulent and started spreading across the country. You talked then about sequencing. Genomic sequencing is very important. I mean, basically what happens is if you get tested for COVID-19 and it's positive, the laboratory that's done that test then will send a certain sample of positive tests to the genomic sequencing centres. We've got the Sanger Institute here in the UK. In fact, the UK is quite ahead of that because of millions of pounds have been invested in genomic sequencing here. India doesn't have the same infrastructure. And of course, as Professor Hunter said, it's had so many cases that they just haven't been able to sequence enough of them. And the importance of that sequencing is to see, are there clusters? Are there different variants in different parts of India? Has it spread because of people travelling on trains and because of the lack of social distancing, because of those rallies that you mentioned? Or has basically this mutation just popped up? Has it evolved in different parts of such an enormous country simultaneously? And this is the type of thing that they really need to know. The type of research that's underway at the moment, but as you said, with the catastrophe that's going on there at the moment, and without that infrastructure, it's not possible for them to determine exactly where it started and how it spread.
Just briefly, Nicola, you look at the UK variant, the Brazilian one, the South African one, and what we know about how those have spread around the world. If the Indian one is in 44 countries, that pretty much means that you can't keep it out of any place, can you?
No, you can't. Professor Hunter said to me, he said, I'm not really in favour of border controls. Possibly if they had been tightened here in the UK earlier, then it might have stopped that variant coming here. I think there's probably going to be more of the Indian variant here in the UK than the UK variant eventually. One good bit is the fact that it does seem, again, anecdotal evidence, it does seem that the existing vaccines do have some effect against this Indian variant, more effect than they do against the South African variant. So if somebody is vaccinated, is protected, it doesn't mean they won't get infected again, but they're not going to end up being hospitalised. But as you say there, no, the chances of it not spreading across the world, pretty unlikely, because of course that same mutation may well have evolved naturally in other parts of the globe.
Yeah, absolutely. Nicola, thank you so much indeed. Nicola Hill, our health correspondent in London.